Most dog owners think they are doing the right thing. They walk into the clinic. They hand over their credit card. They agree to every single test, scan, and checkup the vet recommends. We do it because we love them. We do it because our dogs cannot tell us where it hurts. But some of these routine checkups are not just a waste of your hard-earned money. Some of them are actually dangerous. I am a dog owner. And over the years, I have learned the hard way that the veterinary industry has changed. Today, many clinics are owned by massive corporations. These corporations have sales targets. They have monthly quotas, and unfortunately, that means your dog might be subjected to procedures they do not need. There are 4 specific checkups I would never, ever get for my dog. If you want to protect your dog from unnecessary stress, pain, and overtreatment, you need to know what these are, especially the 4th one on my list. The 4th checkup is part of a multi-million-dollar industry that preys directly on your guilt as a pet parent, but it can trigger a dangerous spiral of unnecessary surgeries that could permanently ruin your dog's quality of life. The anesthesia-free dental cleaning. It sounds like the perfect solution. Your vet or a local groomer offers a dental checkup and scrape. They tell you they can clean your dog's teeth without putting them under anesthesia. They tell you it is cheaper. They tell you it is safer because anesthesia carries risks. You think you are being a responsible owner, you write the check, your dog goes into the back room, they come out an hour later, their teeth look pearly white, you feel great, but you have just fallen for a massive illusion, and your dog might be suffering because of it. Here is what is actually happening. Anesthesia-free dental cleaning is purely cosmetic. It is the equivalent of you going to the dentist, having them scrape only the front of your front teeth and sending you home. Dogs do not sit still and open wide. To scrape a dog's teeth while they are awake, the practitioner has to hold the dog down. They use physical restraint. For a dog, this is terrifying. They do not understand why they are being pinned down. They do not understand why sharp metal instruments are scraping against their sensitive gums. This extreme stress can cause severe behavioral issues. Your dog might develop a permanent fear of being touched around their mouth, but the physical danger is even worse. When a dog is awake, it is impossible to clean the inside surfaces of the teeth. It is impossible to clean the back molars properly. Most importantly, it is completely impossible to clean under the gum line. Periodontal disease does not happen on the shiny part of the tooth you can see. It happens deep under the gums. That is where bacteria build up. That is where the bone starts to decay. That is where the real pain lives. When you get an awake dental checkup, the practitioner scrapes the surface plaque off. The teeth look clean to you. Because they look clean, you assume your dog's mouth is healthy. Meanwhile, underneath those pearly white surfaces, a silent infection continues to rot the tooth roots. Because you think the teeth are fine, you stop looking for signs of pain. Your dog continues to suffer in silence for months or even years. Furthermore, scraping a dog's teeth while they are awake leaves tiny microscopic scratches on the enamel. When a dog is anesthetized, vets use a special machine to polish the teeth after scraping. This smooths out the enamel. In an awake cleaning, there is no polishing. Those tiny scratches remain. These scratches act like Velcro for new bacteria. Within weeks, plaque and tartar build up faster than ever before. If your dog needs a dental checkup and clean, do it right. Do it under proper anesthesia with a licensed vet who takes dental x-rays. That is the only way to see what is actually happening under the gums. Never subject your dog to the terror and the false security of an awake dental scrape. But what about the routine checkups we get every single year, the ones we are told are mandatory? That brings us to the 2nd checkup on my list. The automatic annual booster shot checkup. Every year, like clockwork, you get a reminder card in the mail, or maybe you get an email. It tells you your dog is due for their annual vaccinations. It says they need their boosters. You pack your dog into the car, you head to the clinic, the vet gives the shots, you pay the bill and leave. We have been conditioned to believe that dogs need these booster shots every 12 months to stay safe from deadly diseases like parvo, distemper, and adenovirus. But modern veterinary science says otherwise. Just like in human medicine, once a dog develops immunity to a virus, that immunity does not just vanish when the calendar flips to a new year. For core vaccines, the immunity often lasts for many years. For some dogs, it lasts for their entire lives. Injecting your dog with complex vaccines every single year is not just unnecessary, it can be highly dangerous. Every vaccine forces your dog's immune system to go into overdrive. When you overvaccinate, you risk triggering chronic inflammatory conditions. You risk triggering autoimmune diseases. This is where your dog's own immune system starts attacking their healthy cells. Overvaccination has been linked to skin allergies, chronic ear infections, joint pain, and even aggressive behavior. In rare cases, it can cause life-threatening allergic reactions or vaccine site tumors. So why do many clinics still push the automatic annual booster checkup? Part of it is old habit. Part of it is financial. Annual shots are a steady, predictable source of revenue for veterinary clinics. It gets owners through the door. But you do not have to blindly agree to these shots. There is a much safer scientific alternative. It is called a titer test. A titer test is a simple blood test. It measures the level of antibodies remaining in your dog's blood from their previous vaccinations. If the titer test shows your dog still has a strong level of antibodies, it means they are fully protected. They do not need the booster. Giving them the shot would provide zero extra benefit, but it would expose them to all the risks of overvaccination. The next time your vet says your dog is due for their annual shots, do not just agree. Ask for a vaccine titer test first. If the vet refuses or tries to discourage you, ask them why. A good vet who cares about individual medicine will happily run a titer test. They want to protect your dog's immune system, not just check a box on a computer screen. Now let's look at a newer trend. It is a checkup that has become highly popular because of modern technology, but it is creating a massive wave of anxiety for owners and a mountain of cash for clinics. The genetic health screening. We live in the age of DNA testing. You can buy a kit online, swab your dog's cheek, and send it to a lab, or your vet might offer a comprehensive genetic checkup at the clinic. They promise to screen your dog for hundreds of genetic diseases. It sounds amazing. You think you can predict the future. You think you can prevent a disease before it even starts. But these genetic checkups are a double-edged sword, and they are causing a massive problem in the dog world. Here's the truth about canine DNA tests. They look for genetic mutations. But having a genetic mutation does not mean your dog will actually get the disease. In genetics, there's a massive difference between genotype and phenotype. The genotype is the genetic code. The phenotype is how that code actually expresses itself in real life. Many genetic mutations are recessive. Many of them require environmental triggers to ever activate. Some mutations have incredibly low penetrance. This means only a tiny fraction of dogs with the mutation will ever show any symptoms of the disease. But when an owner gets a report back saying their beloved dog is at risk for a terrifying degenerative disease, they panic. This panic leads to a dangerous cycle. The owner starts treating a perfectly healthy dog like they are sick. They take them back to the vet for more checkups. They demand expensive ultrasounds. They demand blood panels. They demand specialized diets. Some owners even agree to preventative surgeries or long-term medication programs based purely on a DNA result. They are treating a piece of paper, not the dog in front of them. The veterinary industry is fully aware of this anxiety. Some corporate clinics use these genetic screens as a marketing tool. They know a positive genetic marker is an open door to sell you years of diagnostic monitoring, special supplements, and follow-up tests. Unless you are a professional breeder trying to select healthy mating pairs, these routine genetic screening checkups are often a recipe for financial drain and emotional distress. They do not give you peace of mind, they take it away. Remember, your dog's body is a complex ecosystem. Their health is shaped by their diet, their weight, their exercise, and their environment far more than a single marker on a DNA strand. Focus on the dog you see. Watch their energy. Watch their movement. Do not let a genetic report write a tragic story for a dog that is currently happy and healthy. This brings us to the fourth and final checkup on my list. This is by far the most dangerous trap of all. The routine preventive X-ray and scan. This is the big one. As our dogs age, we worry about their joints, we worry about their hips, we worry about arthritis. Many veterinary clinics now offer senior wellness packages. These packages often include routine preventive x-rays or full body scans. They tell you they want to check your dog's spine and joints just to see if there is any early degeneration. It sounds proactive, it sounds loving, but here is the secret the veterinary industry rarely discusses. If you take an x-ray of any middle-aged or senior dog, you are going to find something abnormal, always. You will find a slight narrowing of a joint space. You will find a tiny bone spur on the spine. You will find a mild hip laxity. In medicine, there is a term for these findings. They are called incidentalomas. These are structural abnormalities that are completely harmless. They are just a natural part of aging, like gray hair or wrinkles. Your dog has no pain from them. They are running, playing, and living a completely normal life. But the moment those abnormalities show up on a black and white x-ray screen, everything changes. The vet points to the screen. They show you the shadow. They use complex medical terms. They tell you that your dog has early-stage hip dysplasia or spinal degeneration. Then comes the pitch. They suggest preemptive treatments. They suggest expensive joint injections. Or worse, they suggest preventative surgical procedures to stabilize the joint before it gets worse. This is where the nightmare begins. Surgery is never minor. It requires deep anesthesia, which carries real risks, especially for older dogs. It requires cutting into healthy tissue. It requires weeks of painful rehabilitation. And here is the tragedy. Many dog owners agree to these invasive procedures for dogs that had zero clinical symptoms. The dog went into the hospital happy, active, and pain-free. They came out of the hospital with surgical pain, muscle atrophy from weeks of crate rest, and a permanently altered joint structure. Sometimes the surgery goes wrong, sometimes the rehabilitation fails. A dog that was perfectly fine is now struggling to walk. And all of it started because of a routine preventive x-ray that should have never been taken in the first place. Unless your dog is actively showing signs of pain, limping, stiffness, or a change in their mobility, there is absolutely no reason to get routine structural scans. Do not go looking for trouble, because if you look hard enough with a high-powered x-ray machine, you will find it. And once you find it, you will feel pressured to treat it. So, how do we navigate this complex world? How do we protect our dogs while still giving them the care they need? It comes down to one simple, powerful question. Before you agree to any checkup, any test, or any scan, look your vet in the eye and ask, if this test comes back positive, how exactly will it change our treatment plan today? If the vet cannot give you a direct, practical answer that improves your dog's current quality of life, say no. You are your dog's only voice. You are their only line of defense. Be the advocate they need you to be.